I'm going to mute here.
Hello and welcome to the LCMC Health Live Q&A about the COVID-19 vaccine. My name is Allison Gus. I am the LCMC Health AVP of Clinical and Operational Excellence, and I'm joined here by several of my colleagues at LCMC Health who I'd like to quickly introduce. We're joined from West Jefferson Medical Center, Dr. Labadie, who is an OBGYN. I have Dr. Princess Dinar at UMC Medical Center, who's internal medicine and pediatrics.
Morning.
Dr. Tara Moore from Toro, who is an OBGYN.
Good morning.
And I have Dr. Candace Robinson from New Orleans East Hospital, who is with CMO and with emergency medicine.
Good morning. Afternoon now.
Dr. John Shefflin from Children's Hospital. He's our infectious disease expert.
Good afternoon.
All right, so after we're done here with introductions, let's go ahead and get right into some of the questions that our audience has. Dr. Shefflin, I'd like to start with you and talk a little bit about the speed at which the vaccine was approved and your thoughts on safety. So our first question from the audience is, the vaccine was developed so quickly. Were there any steps in safety approval that were shortened or skipped?
All right, thank you, Allison, for that great question. Yes, things were done more quickly this time, and usually vaccine development takes a very long time. The main reason for that is steps are usually done very sequentially with big gaps in time between them. But because of the federal funding available, we could close all those gaps without compromising any safety. So I'll try and describe this quickly, but make it understandable. So normally we do what's called a phase 1 study that assesses the safety of a vaccine. And that was done with these COVID vaccines that are available now, and no shortcuts were taken. Instead of having, though, a big gap between the phase 1 study and the next steps, which would be the phase 2 and phase 3 studies, because of the federal funding, we were able to compress those phase 2 and 3 studies into one single large study to make sure that the vaccine was not only safe, but effective, and do that immediately after the phase 1 study. And then once those studies were complete, to actually turn that right around, because the manufacturing was started when the phase 2 study was started. So the same steps were taken that we normally take with vaccine development to make sure that the vaccines are safe. They were still done comprehensively like we normally do, but we were able to do lots of things at once instead of spreading them out over 4 to 5 years. And the last little point I'll just add to that is, you'll hear a lot in the news, or have heard a lot in the news, about how the Pfizer and Moderna vaccines are a brand new type of vaccination platform that's never been used before. That is true. However, these vaccine platforms, these mRNA vaccines, have been in development and through multiple safety trials for about 20 years. So we know a lot about them. We know that they are safe. It's even though it's a new idea, it is a safe and effective idea.
Thank you, Dr. Shefflin. So it sounds like these vaccines are very safe, and all of our panelists are supporting this vaccination today. So one question that is coming in pretty frequently is, can I get COVID from the vaccine, or will I test positive for COVID after receiving the vaccine?
Absolutely. So, well, absolutely not. I guess is the right answer. So this is not a live vaccine. It is not, you're not getting the actual virus. You're just getting a little tiny portion of the blueprint or the instruction manual for the virus. So that instruction manual in the vaccine tells your own personal cells how to make that one little part of the virus for a very short period of time, so your immune system can respond to it. So, but it's not the whole instruction manual, so you can't get the actual virus from it or develop the disease from it. I'm guessing your next question is going to be about side effects, so I'll just jump into that right now. You know, every time we get vaccines, the hope is that our immune system responds to it and creates a protection for us. Unfortunately, the way our immune system works is when it really sees something that it wants to respond to, it sometimes does some things that we don't want it to. So for example, you might get soreness in your arm especially after the second dose. Some people might have a low-grade fever or chills that might last for a day or two. These actually, from my perspective, these are actually good things because it means your immune system is really reacting to this vaccine and it is making a really good protective, protection against the virus for you. For those people who have had COVID in the past, you should still get the vaccine. But you may actually have a slightly stronger response to the vaccine, especially that second dose. So your arm might be a little more sore than people who didn't have COVID in the past. You might be more likely to get a low-grade fever. These are all things that we expect, and they're, from my perspective as an infectious disease doctor, these are good things. It means your immune system is doing what it's supposed to do. That being said, only about 10% of people have these side effects. So 90% of us won't have any problem at all.
Great. Well, Dr. Shefflin, you gave me a great segue into side effects. And I wanted to talk to Dr. Denna about some side effects. And one of the questions we have coming in is someone saying, I have other health concerns and I'm scared that the vaccine would interfere with those concerns, such as high blood pressure or diabetes. What can you tell our Facebook audience today about that, Dr. Denna?
I mean, that's a very good question. That comes up a lot. What we know with the clinical trials, that there were patients who had diabetes, who had all of these other comorbidities like hypertension, and we know that there were no major side effects. What we saw were the minor side effects that Dr. Shefflin just spoke about. So some of the local symptoms like the soreness, some of the mild systemic symptoms like the low-grade temperature and the generalized malaise, but no major side effects. What we also know, though, is that those individuals who have diabetes and some of these other comorbidities like hypertension and COPD, if they are infected with the virus itself, they undergo adverse complications and hospitalizations and disabilities and potential even other sequels as a result of the virus itself. So the vaccine is protective in terms of preventing some of the major complications that you would get from this disease for those individuals who have diabetes and hypertension.
Great, thanks. So it sounds like you're saying that their risk of severe disease far outweighs the risk of getting the vaccine. So great to know.
Absolutely.
My second question for you would be, a lot of folks are worried about the long-term side effects of the vaccine and no one knowing these long-term effects, and that might make some folks uncomfortable. How do you feel about that, and what would you counsel your patients on?
I would say anything that is new is uncomfortable, right? So that's not unusual. But no one has had the vaccine in their system long enough for us to know the long-term side effects. So that is the reality. What we do know is that we're in the middle of a pandemic. What we do know is that by monitoring, so what we're doing in terms of more centralized monitoring with the CDC or even the VAERS system, the Vaccine Adverse Event Response System, by monitoring, scientists are able to look to see if there are patterns that occur for people who receive this vaccine so that we can respond quickly and swiftly and more appropriately. The risk, and I think you said this earlier, the risk or the benefits of receiving the vaccines outweighs what the potential complications could be right now without even knowing if there will be potential complications from the vaccines in the future. So I would say, get the vaccine, talk to your healthcare provider. It's not unusual to be uneasy about this. That's a normal response, right? But what we are doing is that we're being diligent as scientists and as physicians in being able to address these complications if they do come up.
Great answers. Thank you, Dr. Denna. I'd like to shift focus a little bit to some very popular topics and some that we have a huge audience. We have a large women's health audience. We have a large number of women employees at LCMC, and turn to our OB/GYN experts here. But Dr. Labadie, let's start with you if I can.
Sure.
How about a question that we're getting frequently about, I'm currently pregnant, and is it safe for the baby to receive the vaccine?
The recommendations right now are that if you are in the group recommended to get the vaccination by the Council on Advisory Immunologic Practices, you should get it, and it's recommended. And that is supported by the American Congress of Obstetrics and Gynecology. The vaccine, like the expert mentioned, is not a viral particle, is not an inactivated virus. It's a very little segment of messenger RNA in a little envelope of lipids. It works in the surface, in the cytoplasm of the cell. It does not go into the nucleus. It will not alter the nucleus of the cell or the genetic material. It's recommended for pregnant women, for lactating women, women planning to get pregnant. If you're in group 1A or 1B and it's your turn, you can go ahead and get it. That's the recommendations as they stand nowadays.
Dr. Labadie, go ahead.
And lactating women should certainly get it. You're going to be the first step into the realm of the baby. If you prevent yourself from getting the infection, it's a big protection for your baby.
Dr. Morse, anything to add to what Dr. Labadie said here?
No, I agree 100%. So, as he already reiterated, it's not a live vaccine. I think I field those questions all day as the OB hospitalist through phone calls here at Toro, asking, will this, affect me in pregnancy? We don't like live vaccines in pregnancy, but this type of vaccine, an mRNA vaccine, from what we know is safe. It has, as Dr. Shefflin has said, it's the first rollout of this vaccine type, but this type of vaccine has been in the works and models are being studied for a really long time. And I think the other main thing that women really worry about is, it's mRNA. You hear mRNA, so everyone thinks DNA, and I'm making DNA in my body with a baby. It's not going to affect that DNA process, and that's super important. So I get a lot of questions about fertility. And so is this going to affect my fertility? Am I not going to be able to get pregnant because this is, an mRNA-based vaccine? And I think as Dr. Labadie already put it, this is not going into the nucleus of the cell. It's not affecting the genetic material of your DNA as it stands. So if you fall into one of the risk groups, we are encouraging women, both pregnant and breastfeeding, to go ahead and get the vaccine.
Great, thanks.
Of course.
One follow-up question to that, I know that we have a large audience that is planning to become pregnant or thinking about becoming pregnant in the near future. And is there any considerations they need to make when planning pregnancy around vaccination time?
No, actually, people are concerned about fertility issues, and it should not be. Actually, getting the virus can affect fertility. They say that it may affect the quality of the sperm, and if a man gets the virus, other situations, but really, it shouldn't alter your planning. You should get the vaccine even if you're planning to get pregnant. What do you think?
I mean, I think the important thing is I have counseled some women, unfortunately with an emergency use vaccine, we don't have the data for pregnant women. This wasn't tested in pregnant women. We have to be honest with that with our patient population. This is why it is a conversation for them, women to listen to these Facebook streams and have a conversation with their provider about the safety of it. But in reality, I think no one should delay their fertility. If they want to delay fertility to allow them to get the full vaccine series so that they actually know they have immunity against COVID before they attempt pregnancy, I don't think that's unreasonable to tell women that's okay to do. But I would not tell them to delay their fertility for any longer period of time other than just to receive their 2 shots.
Great answers. Thank you. We have a question from the live chat from Nick. And do we know if someone gets the COVID vaccine, can they still spread COVID? I'll open that to any of our panelists. Dr. Stefan, I see your wheels turn.
I'll take a first stab at that. So that is an excellent question. I'm going to start off by saying the way that the studies were performed, they were done to see if any of the vaccine recipients became ill with COVID. So we know that the vaccine protects you from becoming sick with COVID. So having symptoms of COVID, it reduces your risk of developing symptoms and requiring hospitalization by 95% or more. We actually do not know yet if it reduces your chance of getting infected and shedding the virus without knowing it. So what that means for everybody is you should still get the vaccine, but it does mean that after you get that second dose, you can't just rip off your mask and throw it away and go to bars and restaurants and family gatherings and feel that you are safe and that you are not going to potentially infect other people. So unfortunately, getting the vaccine doesn't mean the end of masking and social distancing as we know it right now.
Maybe more information to come on that in the future if things are studied a little further, right? We have another live chat question from Barbara. She would like to know about the new variant that's discussed from the UK and other areas about whether the vaccine will be effective against the new variant.
I'll take a first stab at this one too. So yes, there's a new variant that has a very memorable name of B117 from the UK. There's also another variant from Southern Africa that's popped up. What we know about these variants so far is that they are more transmissible. So one person with the infection is more likely to spread it to other people than the older variants that have been, that are the majority of virus we see in the United States now. But there does not seem to be any indication that the vaccine will not protect you from that variant. So the vaccine should still work against these variants. The other thing I think it is important to know is that there's no reason to panic. There's no advantage to getting the old variant versus the new variant. They're both going to make you equally sick and are equally likely to send somebody to the hospital. So we don't want people to panic about it. We just want you to keep masking and social distancing and get the vaccine because it will protect you from the variants, new and old, that are circulating right now.
Thank you, Dr. Shefflin. Dr. Robinson, I'd like to ask you a few questions about immunity and some safety precautions. We have a question that says, I haven't contracted COVID-19 yet with using my current safety precautions. Why don't I just continue to mask and wash my hands and not get the vaccine and I can remain safe?
So my answer to that would be that there is still some risk involved. What we're seeing is that we have a large quantity of patients who are actually contracting COVID from family members. A lot of exposures happen during family gatherings, coworkers gathering. Some of our healthcare workers have gotten it from each other just by sitting and eating with each other. So while we all try and do as much as we can with masking and hand washing, I think the vaccine is meant to help decrease that risk a little bit more to help you from contracting COVID-19. So the vaccine is still the way to go at this point.
Thanks. And Dr. Robinson, I have a live question that I'll point at you is kind of goes along the same line. About how long after the second dose will the vaccine provide protection for me?
So the studies are suggesting that it does take a couple of weeks before you would have immunity after the second dose. That's why we will still have to continue doing masking and distancing, because we don't know exactly the time that you will actually have immunity, but it will not be immediate. And everyone will be in different stages of actually obtaining that immunity after getting your vaccine. So we still have some time after the vaccine before you're immune.
And I know that a lot of questions we've had internally as a health system, people have asked questions about what if I only get one dose of the vaccine? How does that, take my risk or impact my immunity? Any of our panelists want to answer that one?
Dr. Shefflin probably would answer that better, but from the studies that I've read, it suggests that you won't have quite as much immunity if you only get the first dose. You will have some, but you will likely not reach the 90 to 95% that the studies were suggesting that you would reach.
And I think what I read was that with the first dose, and Dr. Shefflin, of course, chime in, but with the first dose, you get about 50% immunity as to why we want that second dose, which brings you greater than 95% immunity with the second dose. And me being a pediatrician, we see the need sometimes for boosters, but we don't know now in the future, right? Because this is new. We don't know what the long-term immunity statement will be, right? So is this going to be long-term immunity for 10 years, 5 years, et cetera? We don't know. We don't have that data yet. And that's what we're going to be looking at. And maybe there might be a need for booster. We don't know yet. But we do know that at least after the second dose, you get at least 95% immunity.
Right, that's exactly right. And so that first dose will protect some people, but not everybody. And the second dose does get everybody up to that 95%. And it probably, the advantage of that second dose is it probably helps your immune system remember what this virus a little longer, which means that you will have longer protection than if you just got one dose.
I think you guys made such great points and answered some questions that I even get all the time personally. And one of those is this vaccine 100% effective? And I think I know all of your answers of what they're going to be, since we just discussed the 90 to 95%. But just reminding our audience too that no vaccine is 100% effective. And so this is a really highly effective vaccine that we're finding so far. We have another question from Joanne on the live chat. Can I hug and kiss my grandkids after the second dose if I wear a mask?
Well, it's not totally socially distanced.
After 2 weeks, maybe.
Yeah, I mean, if it's your family and it's part of your cohort, I mean, I guess who's to say that's incorrect, but maybe after a little bit of time.
A hard question to answer. Other panelists, Dr. Shefflin?
It is. Certainly, I would say, please give the vaccine, that second dose of the vaccine, time to do its job. So that's at least 2 weeks, preferably 3. And again, I think that's it's a very personal question. It's a very individual question. If you're a 55-year-old grandparent with no, medical comorbidities like hypertension or diabetes, that's a different answer than if you are an 80-year-old grandparent with hypertension and diabetes and a heart transplant, right? So these are, like I said, very personal questions, and we would love here to be able to answer all of your questions fully. But a lot of these questions you are going to discuss with your provider.
Absolutely. And one of the questions that we get frequently calling into our nurse hotline and into other avenues at LCMC Health is about immunocompromised patients. or those who take immunosuppressant medications for certain conditions, worrying about if they should take the vaccine, and any advice for that set of patients?
This is absolutely an important question, one that we physicians are having lots of conversations about ourselves right now. So let me first jump into the risks of getting the vaccine while you are immunocompromised. There are none. It's not a live vaccine. The only true risk is that if you are immunosuppressed enough, you may not respond to the vaccine, so you may not get that protection that we want to see. That's the main risk. So again, this is, if you are immunocompromised, again, this is a conversation to have with your primary provider to discuss the risk and benefits for you. And it is available right now for some immunocompromised patients. I know there's some hospitals that are starting to vaccinate their patients, but the first thing they're doing is having that discussion about whether it is appropriate. One consideration I think is, are you going to be immunocompromised for 10 years or just for 3 months? Those are two very different conversations that we need to have.
And I think one final question here that I'd love each of you to provide a little input and final thought to our audience today is, what would you say to encourage others, your patients, your family members, and those you care about to get the vaccine? And I'll start with Dr. Robinson.
Happy to answer that one. I tell people all the time, I got this vaccine not just for myself, but I got this vaccine for all of my family. Although we know that the data doesn't totally say whether or not we will definitely be unable to transmit the virus to anyone, I want to give myself and my family every opportunity to not get COVID-19. So I got the vaccine just to ensure that I am protecting myself as well as my family members from getting COVID-19. I work in a high-risk field in terms of the possibility of contracting COVID-19. While we do all of the proper precautions, you just never know when something might happen, and I do not want to be responsible for passing anything along to my loved ones. So that's the main reason that I got the vaccine.
Dr. Robinson, Dr. Denna?
I would say, so two things is, one is to look at the data. So look at the data because I think that's going to be important in swaying people to outweigh their fears. And the data is showing that it is protective. The other thing I would say is the concept that it takes a village, right? And so one person getting vaccinated is not going to provide herd immunity that we need. And I think I saw there was about 80% is what we're looking at, but that we need to conquer this pandemic. So it requires all of us actively participating and doing our own job to fight this virus. And that is, since the vaccine is available, participating and taking the vaccine. I don't want to underscore the fears that are in the community, because the fears are there. And that's why you have your physician, you have these forums to be able to have those dialogues. And, I encourage you to talk to your physician, talk about the fears so that we validate them, but at the same time, give you the data, give you the information that you need to be armed with the confidence to be able to take this vaccine.
Thank you, Dr. Denna. Dr. Morse?
I echo both of my colleagues' sentiments. I was thinking a lot of the same things. I think, we as healthcare providers need to show to the public our confidence in the vaccine. But just as Dr. Denna said, I don't want to underscore any of our pregnant moms, lactating moms' fears of getting a vaccine that we do still have to admit has not had any trials in pregnant women or lactating women. But, we know from the data, we know that it likely should be safe without any issues. But if pregnant moms don't want to receive the vaccine, I think as healthcare providers, we have to not undermine that decision for them, but support them and still talk about how to keep them safe in their cohort. Talk about hand washing, talk about social distancing, mask wearing, avoiding family gatherings. We do know pregnant women can be at higher, they're at higher risk if they do contract COVID-19 of having severe illness. And this is a good time when they are talking with their healthcare providers to talk about their comorbidities. So are you a healthy pregnant person with no issues? Or are you a pregnant person who's slightly obese with high blood pressure? I mean, now you have those three things all together to increase your risk. And I've had patients myself ask me, what would you do? Well, I got the vaccine. I am a breastfeeding mother. I said, hey, I'm the first step for my child. This has been studied, and I feel real confident in the decision I made to not only protect my loved ones, but to protect my young infant daughter. And I think that's important to tell to the women in this community that if they really do have questions, they need to sit down and talk to their healthcare providers. They need to look at the data, but they also need to remember that an infection from COVID-19 virus is going to be worse than most of the side effects they're ever going to get from this vaccine. And this is a high potential that they need to stay here and, protect the family that they're with.
Thank you, Dr. Morris. Dr. Lavey?
Yes, a little bit of random thoughts here. I agree. As a mother is the first stepping stone of contact of the newborn baby. Please be immunized so you can protect your baby. If you're very vulnerable because of your age or conditions, do get the 2 shots. The strategy of doing only 1 dose and get whatever immunity you can get out of 1 is probably a strategy for when your patient is the population, not the individual. And it gets to the point that that may be a good strategy when we have such a flare-up like we're getting now. We have a horrible flare-up. Thank God it's not as mortal as or fatal as before, but it may be something to be considered, and it's a developing story. About fear of the vaccine, absolutely not. So far, I haven't seen any reason yet. Side effects, anything has a side effect, but it could be even the medium, the lipid, that sort of situation. That's about it, and I'm in favor.
Mayor, please appreciate your input. And I'll finish with Dr. Shefflin to take us out with one final comment on what you're encouraging your patients to do.
Sure, thank you. I certainly, first of all, want to echo the great comments from the other panelists. I think they're all very important. And, I'll just, say one more time, like I think all of us certainly on this panel believe that it is a safe and effective vaccine. And like others have said, you are not just doing this for yourself, but you're doing this for your family members and your community. And by getting vaccinated, you can help the most vulnerable people in our community who are not able possibly to get the vaccine. And also, I think there are probably very few people in our community who enjoy social distancing and masking. And this is just one more step we can take to get rid of all this and feel comfortable again going to the grocery store or to restaurants or whatever, getting together, whatever we like to do. It's a multi-step process, and this is one really important step to getting there.
First, I'd like to thank all of our panelists. I can't thank you enough for your time, for sharing your expertise, and for sharing your personal stories as well. And to our Facebook audience, please continue to check the LCMC Health website and your patient portal for more information on how you can receive the COVID vaccine. We are eager to help you, and we want to be here for you. Thanks for joining us today.
Great.
Thank you.
Thank you.
Bye.
Bye. Honestly,